Okay, welcome to Simulation Sessions. This is Nursing Camp, and this is Boot Camp Sim 1 for sessions of your simulation in the nursing program. And what the simulation will be covering is 1 through 4. These are the assignments that you are independently doing within the lab, and you are to log in. This does not replace the orientation within the um, nursing department. So you should be familiar with the Oculus, and let's get into this. So the first thing first is that, you should be familiar with the Oculus. Now the Oculus is the headset that you'll be wearing when you enter these simulations. So you put the headset on and you're going to notice at the lower corner on the right hand side, at the very bottom of the main screen, you're going to see this U. That is the UB Sim Access app. So once you click on that, then it's going to open up to a login screen. Once you get into that login screen, you'll put your username and Albany Med EDU with your password. You're going to select the classes tab called Sim 101, and the code to join that sim is 101 Sim. There are 4 sims available. Now these sims are very important because they're going to lay down the foundation for the future sims that you'll be doing throughout your nursing program. One is first going to be the hospital room orientation, then the skills orientation, medications, and also PPE, which is protective equipment simulation. So we're going to go through each of these simulations. We're going to talk about a little bit about each of them and what the importance of doing them are. So it's mainly to get comfortable with the Oculus and the hand movements and just be familiar with being in the room, walking around in the simulation environment. It's a high yield simulation, which means that it's going to really imprint kind of the experience and you kind of get immersed in this experience. Like I said, there's 4 simulations and each should take about 30 minutes or so. And, you have the whole semester to complete them. The quicker that you get through these simulations, the easier it will be on you as we start to add more simulations. So let's get into the simulations. So the first simulation that you're going to do is going to be in your book, and you're going to see it at the back end of your regional book, which it covers all the assessments and things that are taught in 101. And within this book, it's going to have the sim requirement, and this page will be at the very end. And also during the simulations, we're going to be utilizing the book because it's going to be covering these assessments that you're going to have. So good practice is to kind of review these assessments because you're going to see them in the simulation. And because this is part of your head-to-toe assessment that is at the end of the semester, it's a good time to get kind of practice and kind of memorize this content. Because as we talked about in the previous content, recall comprehension, memorization of these, landmark sites, the heart sounds, and all those type of things are imperative for you to get into the comprehension and application stage where you actually start to apply what you're learning. So the first things first is you should have a drug guide. If you don't have a drug guide, it's important that you get one. The edition is not really that important. However, the drug guide is used throughout a nursing program. So you should purchase a drug guide. You can be used. It doesn't need to be new. All simulations will have medications. And also within your regional book, you're going to see the list of every single medication that is included in these simulations. And you're responsible to know those for this program. So losartan is one of our first medications, simvastatin and 0.9 flush. There is the A-Wales method of looking at these medications, which is acute and chronic. How does it work? When do you hold it? What do you assess for? Is there any labs associated with it? Is diet related to it? What stands out about this medication? What's the 3 things that are the most important? That's how we analyze the medications, and as we move over to the orientation to simulation. So you're going to notice that the stars here, and these are the most important things that, kind of stand out because they are either validations or they are things that you're going to continually do throughout the nursing program. First is always hand washing, and you'll be doing that in 101. Identification of the patient is one of the most important keys, especially with passing medications and making sure that you're taking care of the correct patients. Hand gestures are basically learning how to operate the Oculus Palpating radial pulse. This is priority. It's part of our assessment, and this is part of our vital signs. Also, counting respirations. Um, but this is how to do it within the simulation. So that's an important part of this orientation. It's kind of how do you transcribe and apply what you're learning in class into these simulations. Next thing is just getting oriented to the equipment, the supplies, how to check a temperature. That's also within the book. Room navigation, call lights, and measuring blood pressure, which is also in your book. So it's a good thing to take that book and kind of say, okay, well, what am I learning about with the blood pressure? Because in this simulation, it's more skills based. So you'll be doing these actions. However, the application of analysis of what you're doing is the most important. Next is measuring oxygen saturations, removing the gown, applying telemetry for the heart, and auscultating the heart and lung sounds and bowel sounds. Which are these? 1, 2, and 3. The next is repositioning the patient into a sitting position. And we talked about this in the previous video. Supine is supper, sleeping. And then high Fowler's, right? So there's also a semi-Fowler's position, which is about 45 degrees. So we have high Fowler's, which is 90 degrees sitting. We talked about shortness of breath, and that patient being in shortness of breath, that was supine. You're going to sit that patient up. So that's called high Fowler's, is a 90 degrees. And then semi-Fowler's is 45 degrees. So this is what we call chronic. And the reason it's called chronic is because most patients will be in the semi-Fowler's position because that is the most comfortable position to be in. All right, so auscultating lung sounds, posterior, and then you see semi-Fowler's right here. Palpate the abdomen, capillary refill, checking for edema, and then assessing the pupillary responses. And most people should be reactive, and that's what you're going to be looking at, whether or not how to use a pen light, and then apply it to that assessment. So that will complete. That should last about 30 minutes, and then you'll be done with it. The next one is your simulation 2. It says simulation 1, but it's simulation 2, and where it's going to be skills orientation. So more meds. You got docusate sodium, albuterol inhaler, insulin glargine, and a flush again. Again, you should have your nursing drug guide. You should be looking these medications up prior to the simulation. So as we move through it, we see donning gloves on, putting gloves on, obviously hand washing, IV catheters, performing venipuncture. So we're going to actually start to look at how to perform venipuncture. And that will be just kind of just an overview. The medical records, looking at the medical records and performing a glucometer check. So checking for the blood sugar. Blood sugar is normally anywhere from 60 to 110, 120. And that is also... that is checked because of the insulin, right? So we check the blood sugar for that. And then we have the incentive spirometer. Now, incentive spirometer is also in your book, and that is for allowing that patient to breathe a little bit more when they're in bed rest. And we'll talk more about that in class. And then there's a urinary catheter, how to assess that bag, and then how to actually check a urine sample from that catheter. Then we'll talk about obtaining a sputum sample, which is also in your book, and then how to suction. Also, patient put in at 60 degrees. You get an NG tube, which you're going to get later, so don't worry too much about that. And then applying a nasal cannula, which is right here. And that is chronic, right? So chronic is when you're having a nasal cannula, there's something wrong with the oxygen. And what we're really trying to do is you don't normally have a patient on oxygen. But that's the first level. Nasal cannula is the first level of oxygen delivery. And you'll learn about that. We'll talk about the different types later. Administering oxygen, how to do that. Supine. So there's our position again. We have supine, we have semi-Fowler's, and we have high Fowler's. And head tilt move, and then which you'll learn in class, and then the end of simulation. And this will also be about 30 minutes. So it's important that you regulate your time. You can come in. You don't have to do all 4 simulations. You can just do 2. You can do 1. It's up to you. So it's important to sign up for your simulation so you can get them done. The quicker that you're oriented into the simulation is the easier it will become for you in order to be proficient in going through the higher simulations later on. All right, next simulation, which is simulation number 3. And this is the med administration. This is a high level simulation because it's what we do. We give medications, and it's important to be aware of the medications and how to administer them. You're going to learn this in the 101 in your nursing program about how to check for date of birth and how to check it in a simulation. So medications, you see Docusate again. You also see influenza vaccine, enoxaparin. Enoxaparin is Lovenox, which is here, so that's also in your book. You also have tuberculin PPD, and then one of our first IV fluids, 045. So 045 no saline, which is interesting because it's a different kind of IV fluid. And if you've been in pharmacology, we talked about that, but we'll talk more about that when we get into it. But you can see it down here. So, and it's called a hypotonic solution. So I always think, 45-ton hypotonic. Don't worry too much about it, but if you're wondering what that word is, that's in your book right here, and you can see that right here. See, this is 45 saline, which is hypotonic, and you can see it's talked about there. That's why using that book is very important when you start to look at your simulations, and you can be preparing for it, because this is in your book as well. So then you're able to look at that and then go back to your other pages to see the references to this stuff. So then we talk about an IM injection, influenza vaccine, how to distribute that, and then PPD. How to use a flush, and this is all stuff just so that you get used to practicing what you're doing in a simulation. You see morphine is there, acetaminophen, albuterol, butadiene. So you have putting up an IV, gathering inhalations, and inhalation is also in your book. Practice additional skills as you want. So that's an important part, because so even though you're in the simulation, play around. Just kind of mess around with different things. Once you finish your simulation, get very comfortable moving the monitor, moving the EMR, moving the bed, moving the patient around, putting them on monitor, taking them off monitor. Just kind of play around in there, get very comfortable. Because as we add the advanced simulations, it's very important that you are comfortable in the simulation. All right, the last one, which is the 4th simulation, which is the PPE simulation. This one takes about 30 minutes, and it's basically from this also in your book, which is donning your precautions in PPE. And what that is, protective equipment, personal protective equipment. And this kind of tells you there's different types: standard, contact, droplet, and airborne. Very important to know the different types. You're going to learn this in your program, but there is an order. It's called donning and doffing, and this is one of your validations that you'll need to do in one of the labs. And so it's important to memorize this donning, doffing. So you always follow this order, and that's the order so you don't cross-contaminate yourself. Again, hand washing is always priority, and then how to do it, and then this goes through that process. This simulation should take about 30 minutes, and you'll see down here in my nursing practice, this just shows that you did it in front of a person. And that means that you are progressing it in the program, and anytime you have these openings in your book, it's something you should do in front of your clinical instructor or in a clinical lab and what you're doing. So that concludes our post-simulation as far as your 4 different areas. Your biggest goal is to get these things done. The sooner the better. You don't have to do all 4 at once. You can do one at a time, but just stay on top of it. Use your book as a resource and start to build your meds and your familiarity with meds. The biggest part about this simulation is this is orientation simulation. So as we start to add on different comorbidities like CAD, coronary artery disease, hypertension, CHF, those scenarios will become more difficult and with more medications. So it's very important for you to become very familiar with these. Can you do these simulations more than once? Yes, you can. Okay, so you don't have to just do it just once. So if you just go get up there, put the monitor on, put the Oculus on, and get familiar with your simulation. Get familiar within the environment. If you have any questions, there's always a person in the office to help you with that, with the setup of it. It's also there's so many headsets, so make sure you're able to sign yourself up and start doing your simulation. So we'll see you on the other side. This is Nursing Camp, and we're out. See you next time.